At the time, 10 years ago, I found very little support other than online, the Haemochromatosis Society, now known as Haemochromatosis Australia. So that really was the only sensible information I could find. I think things have changed enormously. There's a lot more information now available. There's more conversations in the health sector about it now too, because there's more resources available to general practitioners in particular. So I think it is definitely improving.
Joining Haemochromatosis Australia is probably the best thing you could do, because the information that I read, that we got, was invaluable. And I find we've now got our middle daughter's pregnant. It means that she's not menstruating anymore, so she's got to be monitored, her levels a bit more closely, like she's not at any risk. But I dragged that information back out again a couple of months back just to have a bit of a read.
Probably about 5 years ago, I became in official capacity involved with Haemochromatosis Australia, which is a really fantastic organisation that provides support and information to patients and their families, and also conducts advocacy on behalf of haemochromatosis interests. So it just seemed like the perfect fit for me to be involved with them, given that I was researching into the condition and I also had that patient perspective. I mean, the organisation does a lot of different things, whether it is holding information sessions to provide information and good quality information to patients, through to maintaining a really detailed website and an information line that patients can call and get information at any time of the day. We hold scientific conferences to bring together the researchers and the clinicians with the patients and the other stakeholders. We make submissions to government to try and ensure that there's frameworks in place for managing haemochromatosis. A whole range of different activities aimed at raising awareness for haemochromatosis.
I think it's a lot easier to find the support for any condition these days with the rise of the internet. So there's, for example, the haemochromatosis, there's the Facebook group, there's the Instagram, there's the Twitter. So it's easier to find people that are in the same boat.
One of the reasons why a support group like Haemochromatosis Australia is so important is that it is possible to be picked up and diagnosed very early, but that doesn't happen to everybody, and there are people that suffer significant consequences because of late diagnosis, and they do need support, and they do need acknowledgement and encouragement. So I think support groups perform a really major role, and not just in providing support for people when they need it, but also in raising awareness, because the more people, we need people to know that this condition exists, for one thing. We need people to talk about it just in general terms and be aware of it, and we need the medical professions to be talking about it within their sphere of influence as well, and to that would help the medical professions to ensure that they know they've got the right toolbox and the right resources that they need to make appropriate diagnosis for people sooner rather than later. So I think it is very important.